Hello, and welcome to PreViser OHIS. Today I'm going to walk you through how to enable and customize the newest feature of PreViser OHIS, the Home Care Report. For this feature, we collaborated with Colgate in our efforts to help you streamline the home care recommendations and products for your patient based on the patient's individual risk for oral disease. A key component of this new feature is that the recommendations and customization are completely in the control of the provider, and setup only needs to be done once. So let's get started. First, you will need to log into PreViser OHIS. Then on the left-hand menu, you will click on the Options and Settings button and go to the bottom of the screen where you'll see Home Care Report. To enable this feature, you simply click on the box that says Enable Home Care Report, which will light up the box that says Edit Recommendations. Go ahead and click on Edit Recommendations, and you will see at the top of the page both the disease and the risk scores. Currently, we have preloaded some Colgate home care product recommendations based on the disease and risk of the patient. However, it is completely up to the provider on what he or she will recommend to their patient. So on this screen, if I am happy with the recommendations as we see here for this disease and risk category, we do not have to change anything. However, if I wanted to add a power toothbrush as a recommendation for the caries risk score of 1 or 2, we would scroll down to that recommendation. So let's do that. What you'll do is you'll click on Add, and you'll type in the product name. And then you can add some verbiage here about how you'd like the patient to use the products. Then you will update your product recommendation, and you'll see a notification that the update has been made. Now click on Return to List. You should now see your power toothbrush recommendation in this area, right there. If you only want to see the patient use the power toothbrush, you can also remove the manual toothbrush option by clicking Remove here. This is only if you do not want the option of choosing a manual toothbrush once you have started to generate reports. Okay, so let's see how this report looks in action. An OHIS assessment must be completed to be able to view a home care report for a patient. So click on Browse Patient, and if you have no patient set up, you would need to create a patient. So right now we're going to use this test patient, and we will complete a new caries assessment for this patient. So once we have filled out all of the information about this particular patient, we will go ahead and hit Finish, which will generate the oral health report for the patient. So this patient has scored a risk score for caries of a 1. You'll also notice that we now have a new button up at the top here that says Home Care Report. Click there and it'll bring you to an interim screen on what you'd like to recommend. On the left-hand side is what will be displayed on the patient's home care report, just as it had appeared when we set up the recommendation. So you'll notice that there's no recommendation for interdental device. But if I had recommended an interdental brush in any other category, disease and risk category, we could choose it for this one as well by moving over to the recommended interdental device dropdown and selecting one of these. Likewise, if we don't want to recommend a power toothbrush for this particular patient, we can move over to here, to the drop-down list, and then select Not Recommended. The Additional Notes section can be used to reiterate how you'd like the patient to use the products. So once that's done, you can now generate the report. So this is the report that can be printed and shared with your patients so they know exactly what to buy and how to use them. Please note that if any Colgate products have been chosen, it will display the product as well as the link and a QR code down here at the bottom to product offers from Colgate. So that is how simple and easy it is to set up and generate a customized report for your patients based on their disease and risk scores.